I'm with Dr. Ira Gelb, who is a sports medicine specialist specializing in the knee and shoulder injuries. He's with Potomac Valley Orthopedic Associates. Dr. Gelb, the shoulder. I'm a big baseball fan, and I see a lot of young pitchers in baseball coming up with shoulder injuries. Why?
Typically, it's overuse. Some of it also is probably improper preparation. So your shoulder, the injuries are typically either labral injuries or rotator cuff injuries. Tears of the rotator cuff are pretty rare in the young athlete. However, the pitcher and some of the hard, people that are throwing hard, long throws are a unique situation where you might see actual tearing of a rotator cuff in a patient that we normally would not think possible. And that is through overthrowing is probably the number one thing. So throwing too much.
Because now there's like fall ball, winter,
they play all
spring,
year round.
Right.
I mean, they never stop, and I think they're playing on multiple teams, and they're throwing. Are they counting pitches between the teams? They're throwing hard with one team, and then communication's not there. Plus, younger and younger, they're throwing harder and harder, and I think some coaches don't really pay attention to this. So I think. Number one thing is to stick within the guidelines. There are specific guidelines out there for how many pitches a kid should throw at any age. Number two is, I think, listening, being smart and listening to your body. So you have pain, you shouldn't throw through pain. Thirdly, preparation. So the rotator cuff is very important for stabilizing your shoulder as a thrower. And if your rotator cuff is not strong, then it won't protect your shoulder and hold that humerus in proper position, and then you get a lot of you get changes in position of the joint that can pinch the tendon and cause damage, as well as the labrum. Some of it is just the extreme motions of a pitcher that pinch the labrum between the two surfaces. It's definitely we're seeing more and more of this elbow and shoulder injuries in the younger athlete, and I think a lot of it, once again, is just overdoing it at a young age before the body's even fully mature.
Are there exercises, as you said, to strengthen as a
I do think it's important to do rotator cuff strengthening exercises. There's rotational exercises to strengthen the rotator cuff, and maintaining a strong rotator cuff so it doesn't fatigue as quickly is definitely helpful.
Who else do you see shoulder injuries in? What other sports?
Well, I see definitely swimmers are a major group. I see shoulder.
Is that overuse again?
Overuse. So swimmers, interestingly enough, have two issues. One is overuse from swimming, and also a lot of them are hypermobile. They have loose ligaments. And that could go for the same for some of these throwers. If they have loose ligaments, that makes them more at risk. So I see it in swimmers. I see it in the overhead athletes, tennis players, volleyball players. I'll see it in them as well. And
the only way a student athlete or a young athlete can do, a high school athlete, is exercise and trying to strengthen it.
So I think what they want to do is they want to strengthen the rotator cuff as much as possible. They want to maintain flexibility in their shoulder, and they want to use common sense in terms of not overplaying.
Any signs for a parent, I
think number one, if they complain of pain, they shouldn't just say suck it up and play.
Right.
They need to make sure that it's nothing serious. Number two, I think it's something that used to be the case, playing multiple sports, where some kids are playing one sport all year round. It's good if the kids have a break once in a while.
Great information. Thank you, Dr. Gelb. Pleasure.
Sure.